So in this PowerPoint contains few question and answer about maternity and childcare that is frequently accessed in NCLEX board. The first question here, in the fourth stage of labor, a full bladder increase the risk for postpartum complications. So basically, we encouraging mother for voiding the urine. If bladder is full, what complication can start? Number one, shock. Number two, DIC. DIC stands for disseminated intravascular coagulation that lead to the shock. Number three, hemorrhage. And number four, infection. Correct answer said hemorrhage. DIC is a medical emergencies where the bleeding occurs inside and lead to the hemorrhage or hypotension, and hypotension lead to the shock. This question, when you read, we did not see any sign and symptom of infection like fever, so we do not choose the infection. The rationale said a full bladder prevents the uterus from contracting spontaneously and increase the risk for hemorrhage. It does not directly increase the risk for shock or DIC or infection. Next question, which assessment findings in a non-lactating postpartum client require further evaluation? So when you read this question, try to find out the keyword. So postpartum, but mother is not lactating. So what mother is doing wrong, you need to re-educate them. So require further educate. Means what is wrong out of four? Number one, progression of lochia from rubra to serosa. Number three, lack of means or menstruation 4 weeks after the childbirth. Number three, the return from the means within 2 weeks. Or number four, no menstrual cycle 8 weeks after the childbirth. The correct answer is number three, return for menstruation within 2 weeks. So it is wrong. So you have to re-educate or need evaluation. Why? In non-lactating client, menstruation typically resume 6 to 10 weeks after the childbirth. But number three, return means within 2 weeks. It is wrong. Or progression of the lochia from rubra to the serosa is the normal findings. Question, which statement summarized the underlying principle for the development of a parents-child relationship? So underlying principles to development relationship the child with the parents. Number one, parents to be had a good role models in their children. Number two, relationship is part of the adult maturational process. Number three, development is directly related to the physical needs of the neonate. Number four, relationship is based on the need for early and frequent parents-infant contact. So correct answer is number four. So all is important, but which one is first? The first is, as early possible, bring the baby to the skin-to-skin contact with the parents. Relationship based on need for early and frequent parents-infant contact. So rational said early and frequent contact promote the love and also satisfactions and can support the learned parental behavior that enhance the parenting abilities and reduce the ambivalence or feelings of restatement. Having the good, so sentiment, okay. And having the good role models in the childhood may be helpful, but is not the primary principles or part of the adult maturational process excluded. Adolescents who can form the strong infant attachment. The relationship is not directly related to the neonate physical need because human contact is needed for infant to survive. Next question. A nurse is preparing to perform a postpartum assessment on a client who gave the birth 5 hours ago. Which precursor should the nurse plan to take for this procedure? So a healthcare provider is ready to assessment a postpartum mother and who gave the birth 5 hours ago. What are the precursors we should follow? Number one, washing the hand. Number two, washing hands and wearing latex gloves. Number three, washing hand and wearing latex gloves and a barrier ground. Number four, washing hands and wearing latex gloves, a barrier ground, and also protective eyewear. So correct answer said number two, washing hands and wearing latex gloves. So rational said during a postpartum assessment, the healthcare provider is likely to come into the contact with the client's blood and body fluid, especially when examining the perineal region. Therefore, the nurse must wear latex gloves and hand washing alone would either provide adequate protection nor completely with the universal precursor. So we have to follow the standard precursor or we have to follow universal precursor that is included the washing hand and wear the gloves. The nurse should wear a barrier gown and protective eyewear in addition to latex gloves only when anticipating the flushing of blood or body fluid such as during the childbirth. Flushing is not likely to occur during the postpartum assessment, particularly this client who gave the birth already 5 hours ago. Question: the breast engorgement occurred on the second and third postpartum day in both breastfeeding and non-breastfeeding mother. Which process can cause the engorgement? Number one, the body's natural response. What are the normal physiology because of breast engorgement? Or nuzzling the neonate, which stimulates the letdown reflex. Number three, vasodilatation, which causes the breast to feel full. And number four, a reduction in estrogen level. Correct answer is vasodilatations, which causes the breast to feel full. Rational said Engorgement of the breast is not caused by the milk in the breast, but by increasing the blood vessels from vasodilatations. And the body's natural response after the giving birth also reduce the estrogen level, contribute to the milk production. But breast engorgement occur because of dilatations of the arteries. Question: a client takes a hormonal contraceptives to prevent the pregnancies. The nurse should instruct her to use an alternative contraceptive method which is receiving which drugs concomitantly. Number 1, primidone, cyclosporin, erythromycin, and hydrocortisone. Number 1, primidone, antipsychotic medication. Number 2, cyclosporin, immunosuppressive medication. Number 3, erythromycin is an antibiotics. And number 4, hydrocortisol is a steroid. Correct answer is the antipsychotic or anticonvulsant primidone. Rationale said the primidone and anticonvulsant may decrease the efficiency of hormonal contraceptives, also necessarily use of an alternative contraceptive method. And concomitant use of the hormonal contraceptive with cyclosporin, which is an immunosuppressant, increase the plasma concentration of cyclosporin. No interaction occur between erythromycin and hormonal contraceptives. Hormonal contraceptive increase the anti-inflammatory action of hydrocortisone. Question: a client is taking a progestin-only oral contraceptives, or we call mini pill. When teaching the client about this medication, a nurse should include information on sign and symptom for what? Endometriosis. Number 2, female hypogonadism. Number 3, premenstrual syndrome. And number 4, tubal or ectopic pregnancies. Correct answer said number 4, tubal or ectopic pregnancies. So we learn from this question the progestin contraceptive pill or mini pill increase the risk of tubal pregnancies. Rationale said women taking a mini pill have a higher incidence of tubal or ectopic pregnancies. What is ectopic pregnancies? Pregnancy implanted any site except the uterine cavities. Possibly because progestin slow the ovum transport through the fallopian tube. So as we know, the sperm get fertilized the ovum in fallopian tube. Then the zygote have to stay up there at least 3 days, and then it should be migrated from fallopian tube to the cavity of uterus, where the zygote implantation occur and zygote get bigger and bigger. Because of the transportation problem, it is failed to get in the uterine cavities. When it is outside uterine cavity, we call pregnancies. Endometriosis or female hypogonadism or premenstrual syndrome are not associated with progestins, only oral contraceptives. Next question. A charge nurse informs a staff nurse of a new admission in active labor who is coming to the labor and delivery unit. The nurse is currently caring for a client in a labor and another client who has a C-section or cesarean birth schedule within the next half an hour. How can the nurse best manage her client as a care assessment? Number one, call the obstetrician and ask him to postpone the cesarean birth. Number two, refuse to accept the new admission. Definitely it does not make any sense. Refuse the new admission. Number three, ask the administrative assistant to complete the new client paperwork. Number four, inform the charge nurse that the charge in client, so change in the client sensor require an additional staff members to safely care to the client. The correct answer said number four. We could inform the charge nurse that the change in client census require an additional staff member for the safety, right? Rational said a nurse in the labor room or delivery unit cannot safely care for the three clients. Therefore, the nurse should notify the charge nurse that an additional staff member is needed to safely meet the needs of the increasing client census. Also, postponing of cesarean birth is not a best option, although asking the administrative assistant to assist with the paperwork is appropriate. Obtaining an additional nurse is a higher priority. Next question. One day after a client gives a birth, the nurse is performed a postpartum assessment. Which findings indicate need for further evaluations? Your patient is a postpartum after a day. I'm doing something wrong. You need to further evaluate. Number one, lochia nigra. Number two, small clot with meniscus. Number three, uterine tenderness. And number four, lochia rubra. Correct answer is uterine tenderness. Why? So you need further evaluate because something is not normal. Rational said uterine tenderness may be the sign of possible infection. So if you check the vital sign, you will get the high body temperature. It is the other sign of infection that can support the uterine tenderness. Also require further evaluations. There is no such thing as the lochia nigra after the postpartum. Lochia rubra is the first stage of lochia, typically lasts for the first 4 postpartum days. Bright red, and it contains a mixture of blood, mixture of mucus, and tissue debris. That is not abnormal. Next question here. On a client's first postpartum day, the nurse assessment the client's vaginal discharge as a dark red and containing shade of decidua and also mucus. So this is the cell debris after the delivery. What term should the nurse use in her nurse note to describe the discharge? Number one, lochia alba, lochia rubra. Number three, lochia serosa. And number four, lochia. The correct answer is the lochia rubra. Why? For the first 3 days after the birth, the lochia discharge consists almost entire of blood with only small particles or decidua and also mucus. Because of its red color, it is called lochia rubra. Lochia alba contain primarily leukocyte and decidual cell. Appears creamy white or brownish or almost colorless. Lochia serosa contains serous fluid, also decidual tissues, leukocyte, and erythrocytes. It appears the pink brown and is serious and odorless. Lochia is the general term for postpartum vaginal discharge. It does not describe the discharge, the nurse note. So this is the questions and answer we discuss. This important for NCLEX board. Every student must know about it.